There are 4 stages to lung cancer, and it's important to understand that. It's one of the conversations I have with every patient when they come in, because the treatment stage for stage is very different with lung cancer. Stage 1 is where there's a tumor in the lung and it has not spread anywhere. So we consider that to be the earliest stage of lung cancer. And for those, surgery is usually curative. Stage 1, after resection, there is no chemotherapy. It's just close follow-up with screening or with surveillance CAT scans. Stage 2, in general, there are different colors of stage 2 and stage 3, but in general, I tell patients that stage 2 is where there's a tumor in the lung and there's a lymph node that has cancer in it, but it's a close by lymph node that when we do the surgery, that lymph node will come out with the specimen. So surgery is still the preferred approach for stage 2, but with stage 2, surgery would be followed by chemotherapy. If we think it's stage 3, in general, again, there are different types of stage 3, but in general, stage 3 refers to lymph node spread that is spread further away into the middle part of the chest. And in those cases, we would prefer to do chemotherapy and radiation as a first approach with the hope that we get some response and shrinkage of the tumor, and then do surgery as a second phase. Sometimes we do surgery as the first step, thinking that it's an early stage, and discover that it's stage 3 because we do take those lymph nodes out at the time of surgery, in which case the follow-up would be chemotherapy with or without radiation. And then stage 4, unfortunately, we diagnose too many people at stage 4. The therapy is really directed to making people comfortable. If there are areas that are, if there's for example, there can be spots in the brain that are causing issues, that radiation can be done or surgery to remove those. If there are areas in the spine that are involved, they can undergo radiation for the purpose of alleviating pain. Unfortunately, we try not to diagnose it at that stage, but at stage 4, there's there are trials of new drugs that we're implementing, and there are a lot of trials out there. So there is hope for people with that, but in general, we're not going to do surgery or radiation. We're really just going to do things to make people comfortable.